ensure that you have a MAR. What you'll notice is this is a medication cart. A typical medication cart on your unit would have a bunch of drawers with the patient's names on it. Not names, but their room numbers. You'll have some supplies on your med carts, such as a medication crusher. You'll have a nurse's drug guide. You'll have some alcohol. You'll also have some locked up narcotic medications in here. And you can see there needs to be a key. So nurses do carry around a narcotic key. If you have a automated medication dispenser, then you don't need to have a key. You just have to log in using your username and your fingerprint. What you'll notice in here are locked up narcotics at the top. You'll see medication specific room number medication drawers for your patients. So depending on what room they are, you want to just find that. Okay, and you'll also see that there is a biohazard bin here for any sharps, and then you'll have a garbage at the medication cart as well. There is sometimes nurses will carry supplies and ward stock items in their med carts. So you'll see that there are some potassium medications, liquid medications. There's also lactulose that you'll see on your med cart as well as specific medications like ward stock, Tylenol, things like that. Okay. So I'm going to show you what I would do to give this medication to your patient. And this is a typical MAR binder. You'll have this on your unit. Just make sure that you have the right patient when you're checking your MARs. Okay. Another thing that I always want to check on my MAR is I want to ensure that I have the right date for the day. I want to make sure that the bottom of the pages of the MARs are signed by a nurse. That just shows that they did the checks last night to make sure if there's new medication orders, it's not missed. So every night nurse would do a MAR check and look at every single med to make sure that's the right order. And they sign to say that they verified it at the bottom. So every single page for your patient should be signed at the bottom here. Okay? Okay, great. So that when that's done, now I'm going to place it down. I also need to know a few things before I give my patients medications, especially when it comes to any narcotics that can cause respiratory depression. I want to make sure I do a set of vitals before I get the medication. And I also want to make sure I get a respiratory rate to make sure we're not going to oversedate them. Okay? So just to save us some time, I'm going to show you one medication that I'm going to give for my patients. Let's just do the metoprolol at 8 o'clock here. Okay, so what I'm going to do is I'm going to look up the medication in my drug guide, fill out my medication profile sheet, know my complications and side effects, and make sure I've done my pre-assessments before that. Once I've done that, I'm going to verify that the MAR is signed, the orders are in the doctor's orders, metoprolol 50 milligrams POBID, and it is POBID twice a day. So what I'm going to do with my first, before I start, is do some hand hygiene. Okay. Once I've done that, I'm going to pull my patient's medication drawer out. I'm going to find my patient's room, and black here. I'm going to find my specific medication in the drawer. Okay. And this here says it's metoprolol, and black, and it's metoprolol. So I'm going to do my first 7 rights check. My first 7 rights check is the right patient. So N black, the right drug, metoprolol, the right dose, 50 milligrams. The dose I need to calculate is using the specific formula, dose ordered over dose available times amount. So if I do my calculations in my head or on a spare sheet, I'm going to say the dose ordered is 50 milligrams, divided by what I have on hand, which is 25 milligrams, times it by 1 tab, because that's how much 25 milligrams is in. And that gives me 2. Okay, so that's a straight, simple formula to calculate your drug's dose. Dose ordered over dose available times by amount. Okay, that needs to be memorized because you use that forever in your nursing career. So make sure you do that. So I got the dose, I've got the right time, that's 8 o'clock, I've got the right frequency, I've got the right reason. This patient has hypertension, metoprolol will help decrease that. Okay, so that's that, and the right frequency. So it's twice a day. Okay, so now that I've done my first 7 rights, I'm going to take up my 2 tablets. 1, 2. Okay, now that I have 2 tablets taken out of this specific med pack, I'm going to keep it here. I'm going to do my second 7 rights check. So now I'm going to do my second 7 rights. So right patient and black, right medication, metoprolol, right drug dose, 50 milligrams. So I'm going to get 2 tabs because each tab is 25 milligrams. If I want 50, I need to times 25 by 2. Okay, so again, right dose, right time, 8 o'clock, right frequency, right reason. Okay, so that's done. So that's my second 7 rights. Now that I have that, I can put this away now back into the specific drawer for my patient. Okay, so now that I have this, I'm going to grab my pill cup. I'm going to grab my patient some water. And I'm going to take that 1 sheet of medication out, and then I'm going to go to the patient's bedside. Okay, this is where you're going to walk over to your patient's bedside. And so if this is your patient, what you're going to do is knock on the door, introduce yourself, let them know what you're here for. Hi, Mrs. Black, I'm Tina, I'm your student nurse. We met earlier when I was doing your vital signs. I just want to come and let you know that I have your medication this morning. Is it all right? They'll say yes or no. Make sure you do hand hygiene again. And then this is where you want to do a patient identifier check. So, Mrs. Black, Mr. Black, can you tell me your name, please? Full name and your date of birth. Okay, so they'll tell you the full name and date of birth, and then you're going to ask them if they have any allergies. Do you have any allergies? No allergies? Okay, great. So then now I'm going to go to the bedside table, and then I'm going to get my patient's medications ready. Okay, so this is where I'm just going to move you over here and show you guys. This is where you're going to do your third 7 rights check. So you're going to say that you verified the patient's name using their armband already. Now you're going to check the medication, the right meds, so metoprolol, right dose, 50 milligrams, so that's 2 tablets. I have 2 tablets. Right route, orally, right frequency, twice a day, right reason. Okay, that's it. And then now you're going to pour it into your med cup. So you're going to just be very, very careful not to spill it. I've had students drop their pills on the floor. If that's the case, you want to discard those pills and then grab a new one. Okay, so that's 1 tablet. And then this is my second tablet here. Okay, so I've got 2 tablets in the pill cup. And then I'm just going to come over and make sure I show you guys here. So I have 8 o'clock for metoprolol. Now that I've poured it, I'm going to circle it. That circling means it's been poured out of the blister pack. Okay, so now what I'm going to do is, okay, I have your medication here, and then give them the cup and then get them to swallow it. You need to make sure you watch them swallow it, okay? That needs to happen. They can't just say they'll take it later and you leave it at the bedside and walk away. That's not safe practice. We don't know if they'll take it, okay? So if they don't want to take it and they're refusing to take it, then you can take it away and discard it. But you should not leave the medication at the table at the bedside without anybody watching, because they might not just take it. It could go into the garbage and we don't know, right? So once they've taken it, you're going to initial and then write your DCSN, which is Douglas College Student Nurse, next to the time, okay? Whenever you've circled and signed, that means that medication has been administered by you. That's the right documentation for that. Okay? And then you can discard your garbage, walk out, and then reassess your patient after the medication's gone in. You can tell them that you'll come back and check on them in about 15-20 minutes to see how they're doing. Some education is really important too, to make sure they know the side effects that can happen with metoprolol and any other medication.